I'm Julie Barkey with this Senate update. The recent U.S. Supreme Court decision known as Hobby Lobby allows some employers to opt out of covering contraception in its health care plans. On Tuesday, a group of DFL lawmakers proposed that the state enact legislation ensuring that women will have access to contraception wherever they work.
Well, as you know, we're here today to talk about the CHEER Act, which is the Contraceptive Health and Employee Rights and Equity Act. And this is a long-awaited provision, a long-awaited piece of legislation that comes as a result of the Supreme Court decision last summer called Hobby Lobby. We know, of course, about Hobby Lobby. I'm State Representative Erin Murphy, and I'm glad you're here today, and I'm glad to be joined by this group of legislators and Minnesotans to talk about the importance of this issue. You know, women hold the right to decide for themselves when and whether to use birth control without interference from their employer. And an employer's personal religious beliefs should not trump an employee's access to contraception. The Supreme Court's misguided ruling last summer needs that we need to take action here to assure that women and families have access to affordable contraception here in the state of Minnesota. And so we're coming together today around this piece of legislation to take action on it today. The CHEER Act does four things. It ensures coverage by requiring health insurers who cover FDA-approved prescription drugs to also cover FDA-approved contraception, and they are required to do so with no additional cost to the employee, mirroring provisions in the Affordable Care Act. Employers who choose to insert their religious beliefs into their employees' coverage must disclose that to their employees before they're hired, and then include that information also in their first two pay stubs, as well as in the employee handbook. And those religious organizations that are exempted in the law are also exempted in our proposal, but they also must disclose their decision to deny contraception coverage to their employees upon hire. We want to make sure that women have access to affordable contraception. We know that that is an issue important to women's health and to families' health, but this is also an economic issue for families, and we should make no mistake about that. When we choose to have our children, and at one interval, determines a lot about our ability to work as women. This is an economic issue for women and families, just like universal pre-K is, just like the minimum wage for tipped workers is, and just like the Working Parents Act. And the CHEER Act is just one more installment of our efforts to make sure that working Minnesotans have a fair shot at opportunity in Minnesota. And with that, I'd like to introduce Senator Pappas.
So I was watching Downton Abbey a couple weeks ago, and there was this great scene with the lady's maid, Anna Bates. She went into a pharmacy to buy birth control. And first thing she says to the male pharmacist is, "Do you have a woman working here?" So the woman comes out, and she takes out her book, and she shows her a picture of what she's looking for. And the clerk says, "Oh, are you married?" And so she shows her ring. She says, "So, you don't want to have children?" She says, "Well, no, I really can't have any more. I have a health issue." You know, she says, "Your health, huh? Oh, all right." And she hands her the device, and Anna gives her the money, and somebody comes in the store, and she says, "Forget the change," and she rushes out. Okay, so this is 1924. And now we're 90 years later, roll ahead, and women's reproductive health needs are still questioned. Women are still being shamed and humiliated, having to ask their male bosses, "Why do I have to pay $90 for the next 3 months to get my birth control pills?" I mean, that's why we need this bill.
When talking about reproductive health, we often talk about it in terms of choice. The choice to either delay or avoid having children, the choice of which method of contraception to use, or the choice of which provider to see. For many people, however, the choice was never theirs. It's a matter of necessity. My choice is one of life and death. 5 years ago, I was diagnosed with pulmonary hypertension, which is a rare and life-threatening lung disease. And it was in that moment that my choice of whether or not to bear children was made for me. Pregnancy carries an incredible risk for pulmonary hypertension patients, and women have died as early as 10 weeks into a pregnancy. Sorry. With all the uncertainty that my diagnosis brought, I at least knew that I didn't have to worry about getting pregnant. I already had the perfect birth control in place, a Paragard IUD. I didn't need to worry about how hormones might affect my symptoms or interact with other medications I was taking. I didn't have to worry about it failing because it's as effective as being sterilized, which over 99% efficacy. I couldn't forget to use it or take it because it's just there for 10 years. IUDs are the most commonly used method of contraception among women's healthcare providers, so you know they're good. Yet IUDs are one of the forms of birth control that the Hobby Lobby decision allows employers to deny coverage of. They're also one of the most expensive, costing hundreds of dollars out of pocket. Without health insurance, I wouldn't have been able to afford to get my IUD, plain and simple. I wouldn't have chosen to use a less reliable method of contraception like condoms or hormonal birth control because I would have been forced to by my circumstances. Of course, I still could have gotten one in theory. It's not like they're illegal. But without availability, affordability, and access, there will always be people for which they may as well be. We all seem to agree that healthcare decisions are highly personal, yet we repeatedly fail to back that up with the policies necessary to keep them that way, particularly with regards to women's health. No one should be forced to decide whether to get an IUD or pay their rent, to choose between emergency contraception or gas for the month, or to get a prescription refilled or provide dinner for their family that day. But these are the kinds of impossible choices people are faced with every day. Birth control in all of its forms gives us the means to take charge of our health and our lives, to determine what's best for ourselves and our families. Because no one knows what's best for you better than you do, and we can't allow anyone to stand in our way. Thanks.
Hello, I'm Sarah Stace. I'm the president and CEO of Planned Parenthood from Minnesota, North Dakota, and South Dakota. It is my honor and privilege to follow one of our patients speaking today about her life experiences, and I think she's said just about everything that you need to know. It is really unbelievable today, in 2015, that we're having a debate about birth control and that we are having to introduce legislation to protect women from bosses who are trying to deny them health coverage for basic health care. But here today, we've had to do exactly that. Yesterday, I'm so proud that Representative Erin Murphy and Senator Sandy Pappas proposed the CHEER Act, which would confront many of the inequities that are triggered by the disastrous Hobby Lobby decision. And if you don't think that we need this legislation here in Minnesota, just remember that 7 private for-profit companies in this state have filed lawsuits to deny their female employees coverage for birth control following the Hobby Lobby decision, and all of them have won. This not only affects women who are working for these particular companies, of course, but it sets a dangerous precedent for women all across Minnesota who rely on employee-sponsored health care. The bottom line is that this bill would require employer health plans to cover women's health care just like men's, period, and it would end discrimination. Most people agree that if you open your doors to the general public, you have an obligation to serve everyone who walks in your door, regardless of who they are. You don't get to pick and choose. Similarly, if you are a corporation in our state, you hire and you serve the general public, you shouldn't be able to choose which laws to follow either, and you shouldn't be able to choose how you treat your male employees versus your female employees. Politicians and bosses have no place dictating whether a woman can have access to birth control coverage. At Planned Parenthood, we are very proud to stand with our leaders and to support the CHEER Act, and I'm very, very happy and thankful for your leadership.
Good afternoon. I'm Andrea Ledger, Executive Director at NARAL Pro-Choice Minnesota. I, too, am very excited to be here to speak in support of the CHEER Act legislation that will allow women the freedom to make our own choices about our reproductive health. Healthcare decisions, as Sarah said, should be made by a woman and her doctor, not by bosses, not by politicians. 98% of sexually active women will use some form of contraception during their reproductive years. Some of us will use it to prevent unintended pregnancies. Some of us, as you heard earlier, will use it in order to treat health conditions, severe health conditions that can be painful and life-threatening. But all women should have access to affordable birth control. For many women, as Representative Murphy said, contraception is really an economic issue. Unfortunately, the cost of contraception is the #1 reason cited by women who have little or no access to birth control. The cost makes it unattainable for them. Women deserve the freedom when to start our families so that we can attain our educational and economic goals that lead to our overall economic stability. And for those of us who do choose to start families, our children benefit when we're able to give them the best possible opportunities for success. Access to affordable contraception allows women to maintain our own health and the health of our families. I'm looking forward to making contraceptive equity the law in Minnesota.
When I first practiced nursing, I worked in a Catholic hospital, and in one surgical suite they would do a vasectomy, but they would not do a tubal ligation in another. That's a difference between men and women. Women were not allowed in that hospital or clinic to get access to contraception. We had to go off campus and to a private clinic in order to do that. That was in 1985. Now it's 2015, and we're still fighting the same battle. And so while I am happy that you're here today, and I am happy to take up this issue, I'm really, frankly, irritated that we're doing it now. And so with that, I'm happy to answer your questions. Angela, introduce yourself.
I didn't introduce myself. My name's Angela. I'm a patient of Planned Parenthood and reproductive rights advocate.
Do you have any questions?
Can you explain how, Representative Murphy, how this legislation, given the Supreme Court ruling, how you think it would withstand then what would perhaps be a court challenge on that basis?
The legislation that we're introducing requires health plans to include contraception coverage, and it requires that employers who decide to deny coverage based on their religious beliefs to inform their employees at the point of hiring. And at that point, they must give employees information so that they can get access through their health plan directly, contraception with no additional cost sharing.
So you feel it would withstand a challenge based on the Hobby Lobby decision?
The way we've drafted it, it is about access and a mandate for coverage. So yes, I do believe it would.
Would this apply to situations where it's a large company that's self-insured under ERISA and has a contract with an insurance company due to the third-party administration on a plan?
Unfortunately, because of ERISA, we're not able to reach into those self-insured companies with this piece of legislation.
Do you have bill numbers, please?
I believe the number for the House file is 1165.
And have you talked with the Republicans in the House? I mean, what's the climate over there for something like this?
You know, when we introduced this notion in 2012, before the ACA took effect, I was unable to secure any Republican support. And I will be asking the Republicans for the support, both to hear this and if we need to as an amendment on the floor. I know that women across the state of Minnesota and their families support contraception. I believe 90% of families at some point use contraception. It is a basic medication that's used both for prevention but also to treat complex medical conditions like Angela's, and it should be readily available, and it shouldn't be a partisan issue.
At this point, though, you don't have any Republican sponsors again this time around?
I do not yet.
Would you entertain if a Republican were to say, we'll agree to this if you exclude Plan B or morning after, or anything that they perceive as being a spontaneous abortion?
Well, honestly, if you think about the Hobby Lobby decision, its ramifications are greater than contraception. And so I think we have to think more broadly than the issue of contraception. And so, no, I'm not interested in doing those kind of limitations. And in fact, I'm concerned about the expanse of Hobby Lobby and its impact on healthcare delivery for people with serious conditions.
Sarah. wants to say something.
I just want to make a point to make sure everybody understands. Plan B does not cause an abortion. You're talking about emergency contraception. It's emergency contraception. It is not an abortifacient. That is an urban myth spread by those who would like people to believe that it is so, but it is not so. And IUDs do not cause abortions either. We are talking about contraception here.
It works on the lining of the wall, right?
Any other questions?
Can you take a question about the pre-K while you're here?
Is that a question about a question?
Yes, I will.
You just were, I understand, disappointed with the vote today.
I am.
Would you like to elaborate?
Sure. This morning in Education Innovation, we had the second hearing on the universal pre-K bill. The committee had thought they would lay it over for possible inclusion in an omnibus bill, but it has a fiscal impact. So and it was actually Representative Winkler made a motion to send it on to Representative Loon's committee, and it was voted down at that point. I have such strong feelings about universal pre-K and its importance for our future. And when we think about our economy and we think about the achievement gap, there is so much work to be done in the early learning arena. And we finally have a budget that is balanced, and it's balanced sturdily in a growing economy. And now is the time when this legislature must make choices about where we're going to invest for our future. And I can't think of a better investment than universal pre-K for young learners. And that they voted it down today rather than move it through the process and on to the next committee was stunning to me. And I'm not quite sure what it says about the Republicans' priorities, but I think they're misplaced when their first bill is about corporate tax cuts and not about education in our future. I am very concerned about the direction they're taking this state. So thank you for asking the question.
And I'm confident that the democratically controlled Senate will pass the universal pre-K bill.
Senator Pappas, back to this one for a moment. Can you talk about the path you see in the Senate? Do you think the Senate will pass this bill?
Yes, we should have a hearing in the Health Committee, and I think it's Health or is it Commerce?
I'm not sure where it's going first.
Yeah, I think we should be able to pass it. I'm confident that we will. It's really a fairness issue.
It is, but I think we're starting to see a difference, right? So when I think about the hearing that was held yesterday in Representative Garofalo's committee about rolling back the minimum wage for tipped employees, when I think about the vote against universal pre-K, when I worry about whether or not the Republicans are going to give a fair hearing to the Working Parents Act, I think it is really clear that along with this bill today, the CHEER Act, we are working very hard for Minnesotans who work for a living to make sure that they have a shot at economic opportunity and really the autonomy of living the life of their choosing. And I'm not sure my colleagues see it in the same way. Thank you. And thanks for being here.